We are doing this presentation. I decided it to be an introductory type webinar where we actually go over the basic fundamentals of chiropractic. And also, I wanted to talk about the master controller system, which happens to be the nervous system. So we're going to follow along here on our presentation. And I'm going to hit some key points and preface as well some future webinars that we're going to have that are going to branch out from this one. First, I want to go over the main reason why I chose this. The number one reason why people come into my clinic is because something of some type of stress has caused neck pain, back pain, leg pain, or knee pain. Whether it's from the outside, it's something physical, something they ate, or just any kind of stress in their life, it has caused some kind of result as having the symptom of pain. So I wanted to go over not only um, how to manage that stress, but really more importantly is how chiropractic can play a role in adapting the body to that stress. And so if you look here, okay, we're going to talk about stress. Okay, stress can come from different ways, as I said before, but it's basically a response by the body due to a stimulus that has caused the body to have to adapt to it. Anytime that you have the body taken out of some type of imbalance, it's supposed to be under homeostasis, it's supposed to have some type of balance, then the body interprets that as a stress. And so anything the body has to adapt to that takes it off of that natural course of physiological function, it sees it as stress. And so there's three types of stress. And the first one I'm going to go over that most people think about when they think of stress is physical stress. And so if you look on this presentation, I put some pictures out there to kind of show you there's different types of physical stress. You don't have to be in a fight. You can be in a car accident. You can do repetitive things. You can do a lot of lifting. I see a lot of painters and construction workers, welders, those type of things can cause stress. Also, the way you sleep, your posture, the way you're sitting, the way you walk, all that affects the body. And the most common thing that I see that causes physical stress is trauma, some type of trauma. There's different types of trauma. You have major trauma and you have micro trauma. The major kind is micro, where you have repetitive activity. You sit all day, you stand all day, and you lift all day. Okay. The next type of stress is called chemical stress. And so some types of chemical stressors, if you're on prescription medications, if you like to drink alcohol, if you like to smoke, if you like to eat fast food, if you like to eat good food, all those are chemical stress. The pollutants in the atmosphere are also examples of stress on the body, and your body has to adapt that. It has to adapt to that. Okay. And the third type is mental or emotional stress. Now, out of all three, I'll correct my earlier statement. This is the one that people see as being the major source of stress in their life. Balancing kids, balancing work, balancing school, and just meeting deadlines. All of these affect your body and has a physiological effect on the body. And it results in different symptoms, whether it's a short-term stress or a long-term stress. And so the body's initial stress response is first and foremost for survival. The body has a natural innate response to stress in order for you to survive. And so without that initial stress response, you wouldn't survive. Okay. And so I'll show you some examples here. There's two types of stress. There's acute and there's chronic. An example of acute type of stress is if you touch a hot stove and your hand jerks away, that is a stress to your hand. Your body interprets that, and thankfully, it has a natural response to take that away. Otherwise, you would have a serious burn on your hand. Acute stress is necessary for survival, and it's okay to have acute stress. It's the chronic stress that results in diseases, chronic diseases, and it breaks down your body. And we're going to see here on the next couple of slides how physiologically that affects your body. When we see acute stress, um, we see a quick response. When we see chronic stress, we see disease. Okay. And so here on this slide, it says the physiological changes associated with the acute stress response are absolutely necessary for survival. And if you couldn't produce these things, you would definitely die. And so, as we go through this scenario of explaining the difference of what happens to the body with acute and chronic stress, I want you to think about a tiger that's chasing you. Okay, so if a tiger starts chasing you, how does the body change in order to adapt to the fact that you have this animal running behind you? Okay, so when you look at the acute stress response, there's multiple things that occur. And it's pretty it's pretty awesome that your body knows to do this. You don't have to tell it to do this. Okay. And so with the acute stress response, you have an increase in stress hormones. You have an increase in heart rate and blood pressure. Okay. So now you have an increase in stress hormones, so your body can prepare to respond to that tiger that's running behind you. You have an increase in heart rates and an increase in blood pressure, so you can get the blood pumping to the muscles of the body to get away from that tiger. You also have an increase in blood glucose. Your body uses glucose for energy, especially your brain. And so if you have blood glucose that is shunting to your skeletal muscles so that you can run away from this tiger, by all means, let the blood glucose run there. You need that in order to get away from that tiger, okay? So any kind of acute stress, that's one thing that happens. Another thing that happens is you have an increase in fats in the blood and you have an increase in cholesterol. Now, the basic building block of hormones is cholesterol, okay? And we all know there's different types of cholesterol, but in general, we'll just leave it at that. But the reason you have an increase of fat and cholesterol in the body is so that it prepares you for wound healing. It prepares you for steroid hormone production, so for adrenaline, so you are able to respond to an acute stress. And so, in order for you to concentrate on the threat that's behind you, your body, natural ability is that you will experience fear and anxiety. So, just looking at this screen here, you can see how the acute response results in this. But what happens when it becomes a chronic response? Okay, what happens if my stress hormones are always elevated and my heart rate's always high and my blood pressure is always high and my sugar levels are always high? That should start you know, bringing something in you to be like, hey, that sounds like chronic disease, like diabetes, and that sounds like, high cortisol levels and a lot of fat production in the abdomen. Sounds like high blood pressure. Sounds like maybe arrhythmias or things like that. Okay, so we're gonna go to the next slide. So also with the acute stress response, okay, we're gonna talk about a little about what happens in the brain. Your brain starts changing as far as neurotransmitter production. Okay, and so you have a decrease in short-term memory and a decrease in the ability to learn because at the time that the tiger is behind you, you don't care about needing to learn. Okay, you don't care about, oh, let me have good short-term memory. So your body kind of your brain kind of shifts so that you can focus. And so the way it keeps you focusing is that it alternates some specific hormones, okay, and neurotransmitters. So one of the neurotransmitters that actually decrease in an acute response is serotonin. And serotonin is a mood stabilizer, okay? But if it if we shift our minds to the chronic stress response, if you're always stressed or you always have one of those three types of stressors attacking you every day, your serotonin levels, among many things, will start to decrease. And what we know from decreased serotonin levels is that it can result in depression, okay, bipolar, different types of mental illnesses. Also, in an acute response, you have an increased sensitivity to pain. Why? Because if that tiger bites me, I really need to know that it bit me. Okay. You have a decrease in cellular immunity because it's just not that important at that time for you to have an increased immune system. So, right now, kind of think about, well, what if I'm always stressed? What if I always have this stress in my life, whether it's physical, chemical, or mental? Um, what does that do to my immune system? Well, it chronically decreases your immune function. Okay, and then you start seeing things like autoimmune disease, and the majority of your immune system sits in your GI tract. And when we talk about serotonin earlier, about 80 to 90% of serotonin production actually occurs in your GI tract. And so on later webinars, we'll talk about gut balancing and the role it plays in all these things. Okay. Now, one thing I want you to notice too is in an acute response, you're going to have an increase in bone loss. Okay. It's just a physiological thing that happens. So, what happens when you have prolonged bone loss? You get osteopenia, you get osteoporosis. Okay. So, this is differentiating the differences between acute and chronic stress. So just here on this slide, you can see that the chronic stress response can result in all these diseases, okay? And you end up with heart disease, hypertension, heart attack, diabetes. And so when you hear on TV or on the radio that stress is a killer and it will destroy you, well, here's proof that this is what happens to you physiologically. When you have an increase of fat in your blood and an increase in cholesterol in your blood, what happens? You have high cholesterol. You have hardening of the arteries. Okay. Um, this other slide will show you decreased serotonin. You have insomnia because serotonin is very important for you to be able to sleep. Chronic fatigue. You have burnout. Also, if you have an increased sensitivity to pain due to chronic stress, it can result in chronic pain, fibromyalgia. Okay, so what this ought to do for you is start triggering some things in your life, make you start reflecting and make you think, well, what are these stresses in my life that are resulting in my neck pain? That's resulting in, you know, something barely touches my neck and it hurts so bad, or you know, my pants touch my knee and it's just so everything is so sensitive. I feel so inflamed. Okay, you need to look at your diet. You need to look at your chemical stressors and your physical stressors. Okay, now this lovely picture is the tiger all day, every day. Okay, so every time you have a stress in your life, I want you to think about the tiger, and that tiger is always behind you every day, all day. And so we can't take away the stress, all of the stresses out of our life, but how do we and what do we do to make it better for your body to adapt to stressors? Okay, that's the key. Okay, so we kind of talked about these things. Now, there's two sides to treatment that's available to you. Okay, you have the medicine side, the medical side, and then you have, I'll talk about the chiropractic side. Okay, now this is not a bash on medical, and this is not to super uplift chiropractic. It is to tell you the points of view as far as treatment and how each of us are trained differently. Okay, so when you go to a medical doctor, they are trained, and most of them, and in general, they are trained to treat symptoms. Okay, and the way they do that is with drugs or surgery. Okay, now the problem with that is when you start having all these symptoms, okay, and you start separating them, the only way that the medical doctor knows how to treat them, and this is in general for medicine, and traditionally, they give you a drug for that symptom. Then they give you a drug for that symptom, and then that symptom, and then that symptom or that drug causes you to have more symptoms. And next thing you know, you're on 20 drugs. And when my mom passed away, she was on 22 drugs. My dad passed away. He was on 15 drugs. And it all started out with one condition. So that's just the traditional way of treating symptoms and treating disease. The other way is with surgery. Okay. Now, drugs and surgery are very important when it comes to emergency. Okay. So if my arm is falling off or I have a broken bone, yes, I want you to give me drugs and I want you to do some surgery to fix my arm. But yeah, there's a place for both of those. Now, by the World Health Organization, they did a study and they found that in America, America was ranked number one in emergency care out of the top 40 countries in the world. Okay. However, we were ranked 37th out of 40 in overall health of the citizens. And so that's pretty bad. And unfortunately, America makes up to 5 to 7% of the world's population, and we take 62% of the drugs given worldwide. Now, since that study, we've had some issues, with the opioid addiction, and so that's a whole nother study and a whole nother story. But we'll talk more about that in future webinars about what prescription drugs do to you as well. So we spend about 2 times as much as any other country on healthcare. Okay, and so the top three killers in health, we know, and you probably heard this: cardiovascular, cancer, and medication. And so I read one study where I think it was around 2010 where 16,000 people in the United States died just from aspirin misuse. And so to think that something over the counter can cause you to die, you have to be very careful what you're putting into your body. And remember, medications is a type of chemical stress on your body. Okay. Now, let's get to what chiropractic does and how it affects us. Okay. So how do we achieve health? How do we go from stress to health? And what do we do to try to maintain that and make it from day to day? There's two strategies. Okay, either you can reduce your stress, and you can reduce stress in either one of those three categories, or you can improve your body's ability to adapt to that stress. Okay, so my role as a chiropractor is to enable and encourage your body through my treatments to be able to adapt to the stressors in your life. Okay. Now, how does Dr. Payne, how does popping my back, okay, and using that activator help me adapt to stress? Well, let me tell you. Okay, we're gonna go into quick detail. So, some keys to wellness. Okay, you can get adjusted. Now, we call this the Master Controller webinar. Okay, it's to tell you how the nervous system plays a role in making sure that you're able to function optimally. Okay. And so anytime that you have an interference in the nervous system not acting or not functioning correctly, okay, the nervous system can't talk to your body and your body can't talk to your nervous system. It does control everything in your body. Then we have a problem. Okay. That's where you start getting dis-ease. Okay. You can start working on your diets. You can incorporate and add more veggies first. Add some fruit, add some protein and good fats. Um, but you want to do any major changes to your diet, you want to do under a medical professional first before you make any changes. You do want to be active, so you want to do some activity, whether it's light activity or you do Tabata training. You want to stay active as much as you can. Um, Also, you want to really focus on positive thinking. Okay. Um, there's a ton of books out there and a lot of literature out there of how the mind plays a huge role in your health and how your mind can make you sick, and how it can make you well. And just changing how you think can alter your physiology. So positive thinking is very important, very important. And so the nervous system is the master system of the body. It controls everything big and small from top to bottom in your body. What is a malfunction of the nervous system called when it's not correct functioning correctly? Okay, we call that a subluxation. That's the proper term for when you're out of alignment and you have interference, uh, you have nervous interference in the body. Okay, so let me kind of show you how this works. So you see here, and I have a big banner in my office that really shows this in detail. But you can see here how the brain sends information down the spinal cord, through the nerves, out to every organ, tissue, and every cell in the body. And then all those, every organ, tissue, and cell, speaks to the brain. So it's the continuous communication that goes back and forth. If you have any interference in that, neither one can function at its optimal level. Okay. And so this is where chiropractic comes in. If you look at the spine, you can see how these nerves leave out. Okay. For example, it goes to the heart. Well, if you're out of alignment, whether it's due to physical, chemical, or emotional stress, okay, either three of those can affect that. Then that information that leaves the brain and goes to the organ, and the information that goes from that organ to the brain is now blocked. Okay, it's interfered. And what I'll talk about in future webinars is how this actually affects your cells. Okay, all the way down to the cellular level. You wouldn't think that just you being out of alignment, I'm not hurting, so I must be good, or um, I'm my L5 feels like it's out of alignment. And so, doc, I need you to fix that. But to really know what's really going on in your body makes a huge difference to prevent that from resulting in any organ dysfunction that's going on here. Okay. Now, on this left-sided picture, you can see there's tons of nerves in the body. It goes everywhere. And so that's why when I adjust people, I make sure to check them from head to toe. Okay, so if you're out of alignment anywhere, it can affect it. Now, the main part, where I like to start is the spine, because that's the spine is so detailed, and there's a reason why your nervous system is housed in the spine and it's housed in the skull, because it is the master controller system. It must be protected. So the major term for a misalignment of the spine that causes nerve interference to the organs, cells, and tissues of the body, leading to symptoms, disease, and system failure is called a subluxation. Okay, so that's the word that you need to think about, when you feel like you're out of alignment, or you want to make sure that you're preventing any of this from happening. Okay, and so the type of technique that I like to use is called the activator method. If you go to activator.com, it will show you videos on Activator. It would also show you some research. It is one of the only instrument adjusting techniques that actually has clinical trials that can show you its effectiveness. And our next webinar will actually show the difference between traditional chiropractic, where the chiropractor uses his or her hands to adjust the body, versus instrument adjusting like the activator method, and the effectiveness of both of them and comparing both of them. But you can go to this website. They have tons of information. I also put this YouTube video that explains how the activator method works, what it looks like. So if you are new to this, or you have never heard of activator, you can click on this video, and I'll send this out to you all. You can click on this video and it'll show you the actual protocol. So if you ever come into my office, you will already have that visual of how the technique works. So here on this picture, what I wanted to show you is it's not just about popping joints, okay? It's not just about putting you in alignment in one dimension, okay? You have to, as a chiropractor, I have to look at you being out of alignment globally, okay? So this X-ray is showing a before and an after. So here, okay, you have the spine, you have the neck. And so on this before picture, you see how it's actually a reverse curve. That's what we call it. Okay. And I'll show here. This is how it's supposed to look. It's a backward C. So on our previous picture, we showed how the spinal cord goes through here. Okay. But if the spinal cord is supposed to be in this shape, if it's in this shape with the head forward carriage, can you imagine what happens to the spinal cord? Can you imagine what happens to all the nerves that exit out from the spine if it's in the improper orientation? Huge physiological changes. Huge. This is a huge subluxation on the left, okay? And so it's not just about popping, it's about corrective care. Here's another one here on the next page. This is more of a military neck. We call it a straight neck. The other one was more of a reverse curve. Um, Here you also have some disorientation of the spinal cord, and you can see how, if you don't have this C-shaped curve, and there's no way that you're not having any stretching of the nerves that exit. There's no way you're not having any stretching of the tissues, of the tendons, the ligaments. All that is stressed, and so it's very important to have this C-shaped curve. That's why I like to use things in my practice like the posture pump, neck tractioning exercises to help correct this. And this last one shows scoliosis. So if the spinal cord is supposed to be straight here, imagine the traction that's happening here in the spinal cord. It's huge. This is damaging effects to the tissues. So imagine the information that's not going to all the organs, nerves, tissues, and cells in your body due to this. Okay. So it's more than just, I feel a twinge. It's more than just, I feel like I need to get popped. It's more of functioning. You have to have this functioning. Okay. This is information that is not told. This is information. This is why I'm doing this webinar, because it needs to be told. It needs to be taught. This is not the traditional biology that's taught in school. Okay, this is specific things to chiropractic. This is the master controller system of the body. This is why we have chiropractic. This is the fundamentals of chiropractic. It is so powerful, it'll change your life forever. And so I hope from this you understand the importance of chiropractic. That's what I want you to get out of it. What it does to your nervous system, how it plays a role, and how it works with the nervous system. And our primary focus as chiropractors is to help enable your body to work at its optimal level and to enable your body to function at its optimal level all the way down to the cell. So when we're muscle testing and we're adjusting you and I'm going through my treatment, all that's going in my head. Okay. And so, think about when you see your chiropractor, think about what they're doing. It's not just a pop. These are specific treatment techniques that are necessary in order for your body to function at its optimal level. So I hope you enjoyed it. Again, our next webinar will cover the differences and the treatment differences between the activator and manual hand adjusting and the effectiveness of both. And it will also tell you physiologically what happens when you get adjusted by an activator and what it actually does. So if you have any questions, feel free to send a message in our chat box, or you can call us at 817-731-4848 or email us at salenschiroclinic@gmail.com. Thank you so much.